next slide, please. The next slide will be the introduction with Supervisor Wagner and myself. You see our title there. The following slide will talk about Operation Independence, which we started on New Year's Eve 2020. And honestly, that is 2 weeks into the beginning of the end of COVID, as you know it, because on December 16, 2020, we received our first shipment of the vaccine here in Orange County. And we quickly realized that even though the first phase of the vaccine, well, you probably heard people refer to it as phase 1A, focusing on critical and healthcare workers. We know that there are healthcare workers in Orange County who work independently, meaning they're not tied to any health system, and there was no place for them to go for the vaccine. And that's why we launched Operation Independence to vaccinate every willing resident and employee. And our goal is to finish vaccinating the majority of folks in Orange County by July 4th, hence the term Operation Independence. Vaccination will be provided primarily through several methods, but one of the biggest way that you probably heard we talk about is the SuperPod point of dispensing, being at Disneyland, Anaheim Convention Center, and Soka University. On the right side of this screen, you probably have seen one of many of the social media talk about Operation Independence that Orange County has launched under the leadership of the Board of Supervisors and Supervisor Wagner support. And so next slide, we'll talk about the latest information on COVID-19 and the vaccine itself. So I think I'm going to talk about how the vaccine get distributed to in Orange County. On the next slide, there is a schematic. I know when you look at the screen on the next slide, it is pretty small. On the right-hand side, that is explaining how the vaccine will come to Orange County. Briefly, the federal government allocate or distribute vaccine directly to Orange County via the pharmacy chains. They call it the pharmacy partners. And in Orange County, they are CVS, Walgreens, and Rite Aid. It is important that if you would like to get an appointment through them, you can go on their respective websites and get an appointment. Please do not walk up to the individual store, as well do not call the individual store. You have to go onto their website or ask folks to help you to go onto the website and make an appointment. The second way that it comes to the federal government, from the government, is come directly to what we refer to as the community clinic. And there are a couple of community clinics in Orange County that are receiving the vaccine. And then the federal government would allocate vaccines on a weekly basis to the state. And from the state, very soon, Blue Shield is an entity that would provide that function, allocating vaccine to local county. And underneath there, on the very last line, these are the type of provider, including the Orange County Healthcare Agency, that will be receiving the vaccine to help vaccinate our folks. So next slide, we'll talk about who's eligible for the vaccine. Currently in Orange County, people who are eligible for the vaccine obviously continue to be the healthcare workers, people who work in healthcare sector, law enforcement in high-risk settings, and our most vulnerable population, those will be the adults 65 years and older. Just this week, the state have allocated vaccine to local entities like the county to start vaccinating educators, food service workers, emergency services, and childcare providers. And you probably heard the term referred to this group as the Phase 1B Tier 1. So next slide, we'll talk about how will you know when you're eligible. And you can go on to our website at covidvaccinefacts.com. That's one way to find out whether or not your profession or your age is eligible to get the vaccine. The other way is to go onto our county-developed apps, and the app is called Othina, but you can go onto either the app itself, or if you don't have a smartphone, you can go on the computer and type in othina.com, and it will take you to the website and will tell you when you are eligible. But what I would like to encourage you to do is enroll onto the Othina, and then we will inform you to make an appointment when is your turn, as well as when we have the vaccine available for you to make an appointment, okay? Other ways to do this is really check with your primary care provider to understand the eligibility and any impact on your overall health. Now, next slide, we'll talk about how to get the vaccine when it's your turn. As I mentioned earlier, I think we jumped a slide ahead. Can you go back one slide? Yes, so when your face is eligible, Othina will either send you an email or will send you a text messages and tell you, hey, it is your turn to make an appointment. And again, the eligibility list is put together by the state, so we don't control who's eligible. And so the state prioritizes it with a group of input from the citizen. And then I would ask you that the allocation come to each county, including Orange County, has been very, very small. I mean, it's very, very small compared to the number of the demand. And so I'm asking you for your patience. I'm very hopeful that within a month or two, we will get to the point where we have enough vaccine for those who want it. But right now, we do have a very limited amount of vaccine each week. And next slide is where it talks about Othina. I'm not going to go into the detail. I would invite you to either get onto Othina apps or get into othina.com website and try and enroll. What it does is if you enroll, and we will timestamp the time that you enroll, and then we will look on your age, and by the time you are eligible, and when there are vaccines available, we will create appointments. I believe currently we are making an appointment 3 days at a time based on the number of vaccine that we receive. And then when you are invited to make an appointment, you'll be able to go in and make an appointment on Othina, okay? Next slide, please. I know that we have perfected in such a way that when you show up to any of our pods, point of dispensing again, next slide will show you a very satisfied customer. You can see there, people love it. I know it's frustrating to wait for your appointment, but once you get an appointment, the experience is fantastic. Usually it takes about 45 to 60 minutes on the average, including the registration when you get on site, including the 15 minutes you have to wait after you receive the vaccine. So we know that we have perfected that, so we can get people through the line very quickly, as well as ensuring that we can vaccinate as many people as we can. Now, next slide will show you where are the Orange County pod locations at. And please, again, go on to the our website. It will give you a schedule of 3 days. Now, on this one, it shows 4 days, but usually 3 days on which site that is available to open for vaccination and which site is closed. You probably noticed today on this schedule that Disneyland will be closed tomorrow and Friday. And I want to let you know is because we are converting the Disneyland to be a drive-through vaccine site, whereas the convention center in Anaheim nearby is a walk-up. So because we've heard that there are people who have trouble getting in and out of their car and they want to have access to drive-through, and then after a few weeks of making sure that we have a process to ensure safety for people, we have decided to convert Disneyland into a drive-through site. Next slide, talk about the experience at Soka University as well as Disneyland Superpods. We're very proud of that work. Each site can vaccinate up to 8,000 individuals daily. And honestly, the average vaccination time is about an hour, as I mentioned earlier. Okay. Next slide, we're going to talk a bit about the mobile pod deployment. And then the slide after that will clearly talk to you about the purpose of our mobile pods in the community. So next slide, we have introduced the mobile pods as a key approach in Orange County's plan to assure that there's equitable access to COVID-19 vaccination for senior 65 and older. So if you forward to the next slide, it will talk about how the purpose of the mobile pods is for senior is based on area where we have low income folks, people who are more vulnerable to COVID-19 and have challenges with accessing vaccine through our existing sources. So we want to align with the state's guidance. Remember, you probably have heard that the state wants us to make sure that we have an equitable distribution of vaccine in the lowest socioeconomic area in Orange County. And we understand that mobile pod bringing the vaccine to the neighborhood, to the community, is the best way to address that. Next slide, we'll talk about more on the mobile pods in our community. And what we've done is we're utilizing an evidence-based platform to really tell us where in our community there is a vulnerability index, meaning area where there's where our poor community exists, and where our community where we have limited transportation or housing disparity, as well as area in Orange County that throughout the last 12 months, we tend to have a higher number of cases of people with COVID-19, as well as a positivity rate due to these, what we call social determinant of health. And clearly, vaccine allocation from the federal government to the state to us is based on the equity data and the vaccine availability. Next slide, please. So this slide just gives you an example of what the vulnerable maps or vulnerable area in Orange County are. If you look at it, the darker area depicts the area in Orange County with the lowest income community, with the community with most vulnerable folks. And so on next slide, the parameter, it talk about the mobile pod parameter, right? And so you heard me talk about the SuperPod at Disneyland and at Soka University, where each day we can vaccinate up to 8,000 people. The mobile pods are smaller, and we only have staff that are able to vaccinate up to 1,000 people per event per day. And all of these mobile pods currently is not walk-in, and is that they still have to, you folks still have to make appointment. And then we have been able to set up pod site across the county to meet the need. We do know that even though you saw the map earlier with the darkest dark color in central and north Orange County, but we do have pockets of a vulnerable community and poor community in South County as well. And our goal is to make sure that we take the mobile pods across the county to ensure that we get everyone access to a vaccine. Next slide, please. Now I'm going to launch into some facts about COVID, and then the following slide will probably dispel some of the myth and talk about fact on COVID and the vaccine. So hopefully it will address many of the questions that you intend to ask Supervisor Wagner and myself. And so the first thing is, you probably heard that over the last weekend, the FDA has authorized another emergency use of another vaccine that is produced by Johnson & Johnson. People refer to the Johnson & Johnson J&J vaccine, or people can also refer that the Janssen vaccine is the same thing. So since the end of this week, last weekend, we now have 3 different vaccines: the Pfizer, the Moderna, and the Janssen or the J&J. All are safe. None of them skipped any process in getting authorization. They all went through rigorous testing with over 116 clinical trial participants altogether. That is a very large number. Historically, in order to get any approval authorization from the FDA, any medical product maker have to go through clinical trial. And it's very difficult to get people to participate into the clinical trial. But this time, because of the need, the global need for a vaccine to respond to the devastating effect that COVID have had on the community, many people from different countries raise their hand and want to participate in these clinical trials because everybody wants to find an answer for us. And that's why we were able to afford and recruited a large number of people to complete the clinical trial in order for the FDA, which is the most the strictest entity in the world that are assessing whether or not a product would be able to get into the market for consumer use. And so I'm very confident that we have the strictest entity in the world. And if you pass muster through the FDA, you are very, very good. All authorized of the COVID vaccine have an efficacy rate that's higher than the common seasonal flu shot that we are familiar with. And so I know the other myth is that are the vaccines safe? Absolutely. But obviously, there are side effects with the vaccine that you heard about. And all three of them, the common side effects that people talk about are headache, pain at the injection site, swelling at the injection site, and nausea. But those are temporary and they will go away. There are some people who develop rash around the injection site that could last up to 7 days, but then they eventually disappear. The notion that these vaccines change your DNA, that doesn't happen. I want to reassure you that all three vaccines do not change your DNA. The FDA, the Food and Drug Administration authorization, does not require individuals to get a vaccine. I want to let you know that there was a question is, would the government require that everybody get the vaccine? From the FDA's perspective, an individual does not need to get a vaccine if they don't want to. However, there are conversations in the country now that perhaps from an equal opportunity perspective as it's related to employment labor law, that some employer might be able to mandate the employee to get the vaccine. That is a very hot topic right now. And so more to come. I would encourage you to follow the news and see the updated as is related to the labor law around the requirement for the vaccine. Now, next slide is going to talk about whether or not when you get the vaccine, will you be tested positive for COVID-19? No, the answer is no, because the vaccine does not give you the virus. So you will not be tested positive for COVID-19. And I already talked about the minor side effects that some individual might experience. And there is no scientific evidence to suggest that COVID-19 vaccine could cause infertility. And I know for women and lady out there that this is one of the concern. So as of now, there's no scientific evidence to suggest that COVID-19 vaccine could cause infertility. I think that's all I have, Supervisor Wagner. If we could just go to the question and answer segment, that would be fantastic.
All right. Well, Dr. Chau, thank you for that, and I assure you we have plenty more to go through. We've been getting messages come in, questions come in, and we had some in already. But there are a couple of preliminary things I want to make sure that you and I address.
Yes.
And one of them is the issue of safety. Now, I'll say I personally have not had the vaccine yet, but I'm not in a tier to which it has been offered. I, from everything I can read, would have zero problem whatsoever taking it, and will as soon as I'm eligible. You are in a tier that is eligible.
Yes.
Have you had the vaccine?
Yes, I have. And people are questioning, well, why did Dr. Chau get his vaccine? And that's because Dr. Chau has been vaccinating people since January. And for those of you who probably have seen me, I've been out in the community vaccinating people since January because I think that's my duty to understand what is it that the community needs. So unless you're out there and vaccinate people, you don't know how people feel and you don't know what people need. So, and all of the people in Orange County who participate in the process of vaccinating folks, whether or not you're a volunteer or you're an employee, whether or not you're the vaccinator or you are there to make sure you enroll people, they need to be vaccinated because they're interacting with a lot of folks, especially our senior. So we want to make sure that the senior get protected. And that's why we vaccinated anybody who work in a site that vaccinate folks. And so I can tell you, the first shot, I got Moderna. The first shot went okay. I only have sore in my arm a bit at the injection site, but then 2 days later it went away. And then 4 weeks later, that's when you do for your second shot for Moderna. And this is an opportunity for me to share with you that the first shot and the second shots are identical in terms of the amount of vaccine that you will get. And after the second shot, though, Supervisor Wagner, for about 36 hours, I was nauseated. And as a physician, people always complain to me, patients, that I take this medication, I take that medication, and I feel nauseated. I never understood what that meant, right? Because I've never had nausea in my life until the second shot. And I'm like, oh, this is what nausea is like. And I also have some swelling and some pain on my arm. And I did have fever and chills, but that's not something that a Tylenol or an Advil couldn't take care of it. And then 36 hours later, it went away. Okay. So we do hear people that they have some side effect like that after the second dose.
Mm-hmm. But in terms of the safety, you're willing to have taken it yourself, as obviously you did.
Yes.
There are some potential side effects, but
yes.
As and the slide says there,
and I just have to be transparent. Everybody probably have heard it on the news. There have been a few cases where people passed away after they got the second shot. Mm-hmm. So there's still investigation. We don't know, was it related to the vaccine or not? And so there's ongoing investigation, but there have been few cases far in between.
All right. And approximately how many vaccines have we been able to give out here in Orange County?
So in Orange County, we believe that if you look on the state website, even though there's a delay, there has been over 700,000 doses that have been put in arm in Orange County. And I can share with you that even on that website, it's only listed where people live in Orange County. I do know that in Orange County, you don't have to live in Orange County. If you work here in Orange County full time, you serve the Orange County community, you provide care, or you provide whatever services that you provide in Orange County, we will vaccinate you. And so I believe that we have vaccinated a significant number of people who live outside of other county, but they work in Orange County. So that number you saw on there only listed people who live in Orange County who've gotten shot in their arms.
Okay. And with respect to the PowerPoint that we just went through, I know there was an enormous amount of information in it. It went quickly, and it may have been a little bit difficult to read. I have been told that the healthcare agency will be posting that PowerPoint on their website, and so it will be available to you to download, to go through at your own leisure, take a closer look at it, and maybe answer some of those questions. And so let me start with a very, very basic question right now. We have been living under the direction of Sacramento in terms of almost every response to COVID. What we can do, when we can do it, what is open, what is closed, who gets the vaccine, et cetera. For the public, walk us through the governor's colored tier system and explain where Orange County is now, where you expect us to be very shortly, and what that means for people.
Yes, so thank you, Supervisor Wagner. I think Supervisor Wagner, what you're referring to is known as the Blueprint for Safe Economy, and is developed by Department of Public Health, California Department of Public Health. And so that schematic divided the stages of opening of businesses, school, etc., into 4 color tiers. So the most restricted tiers is the color purple. And then the second less restricted tier is red, and then orange and yellow. And each of those tiers has a range of 3 different metrics that you have to fall under in order for you to move from one tier to the other. So the first metric is positive cases per 100K, right? Mm-hmm. So if you test people and then you figure it out how many tests positive for that day per 100K. So that is one measure, one metric. The second metric is the overall positivity rate in Orange County, meaning if you do this many tests and this is how much you come up with positive cases, and you figured out in your population on the number of total tests that you've done, how many tests is positive for that day. So let's say there was 100 tests done today, and then out of those 100 tests, there are 2, so then the percentage is 2%. right? So that's how it's calculated. And then the third metric is what they call the equity metric. The equity metric is simply the positivity rate in your lowest socioeconomic area, the lowest quartile. And so the state has identified. So if you remember, I showed you the map earlier where it's really dark blue, and that area is perfect, kind of perfect fit into the lowest SES quartile in Orange County, right? And so the state would look at the positivity rates of those of our citizens who live in that lowest quartile, and then the state want to make sure that we do everything we can to ensure that there are testing available in those areas, education so people know how to prevent infection, and then you need to bring that positivity rate really close to the overall county, which we have done a fantastic job. Our positivity rate in both the overall county as well as the equity area, we call it the lowest SES quartile, are now in orange tier, about 5%. So that is a fantastic job. So all the three metrics have to fall under the same range that is spoken for each of the college in order for us to move. I'm happy to share with you that we have seen a dramatic drop in the case number, the case per 100, as well as dramatic drop in the positivity rate, that I am very hopeful that by next Tuesday, we would have 1 week of our number in the red tier, and then the following week, we will have second week of numbers in the red tier, then we can move into the red tier. In other words, you have to have the metric, the number, in a certain college tier for 2 weeks before the state move you into that tier. And so my hope that perhaps by March 17, that will be our first day where the state said, Orange County, you're in the red tier. Okay. So I'm so looking forward to that.
And what does it mean to be in the red tier as opposed to in the purple tier or the orange and yellow?
Yeah, so there's a chart on the state website, and I believe we post that too. If we don't, we make sure that we link to that. Because each of the college tier, there are a certain set of businesses or entity that could open, right? And so the purple tier, the most restricted tier, most of the businesses are closed, with the exception of restaurant is open outdoor only, and then church services are able to have 25% indoor, right? But we recommend the government, the Sacramento recommend that people should do it outdoor. So most of the things in the red tier, purple tier are outdoor. But when you move into the red tier, and that's when restaurant is able to open indoor at 25%, etc. So there's other business sector that could open indoor in red tier.
All right. And you and I earlier today participated in a town hall dealing with mental health issues, especially the suffering that some of our children are experiencing. And through COVID, we know obviously about the physical problems, from death to some of the so-called long hauls to just folks that are in emergency rooms on ventilators in ICUs. We know about the physical, but that's not the only toll COVID is taking. Talk to us for a moment, if you would, about some of the mental health issues that we're experiencing out in the community, what people can do to help alleviate those issues, and a little bit about your background so folks know where you're coming from on that.
Okay. So my background, by training, I'm a psychiatrist, right? And my public health experience is in HIV. And so that's why you appointed me the county health officer, because of my public health experience. But from the mental health perspective, we do know that early on last year, some of you probably know that I've been involved with Be Well Orange County, is a mental health movement in Orange County to ensure that we have a system of mental health care for all who needed it. And so early on in the pandemic, we realized that this social isolation, this lockdown at home, could have an emotional and a mental health effect on our citizens, particularly the elderly and the youth. And so the healthcare agency, behavior health department under the leadership of my colleague, Dr. Jeff Nagel, early on, have ensured that we have access for anyone in Orange County to call. So if you need mental health services, you can call the county, and that number is OC Links. And so I think folks are very familiar with the OC Link number, and we'll make sure that we post that on our website. And you can just call. It doesn't matter if you have insurance or no insurance. You need to talk to somebody, you can call. Or you can call the warm line in Orange County that operated by NAMI, right? And so 24/7, if you need to talk to someone, you can call the warm line as well. And we have developed programs specifically aiming at teaching parents to how to work with our children, our youth, teaching teacher on how to work with our youth, because we do know that we conducted a survey last year, I think around August, September, and there were 2,000 parents who responded to that survey. And the result of that is that over 51% of the parents reported that they have seen a significant emotional toll on their children, especially in the area of depression and anxiety. We know that. We know that our children need to be in school, in person, so that they learn how to communicate, associate, interact with adults and also with their peers. And so we know this physical distancing or isolation is very difficult in our children. And we know that not everybody can learn over online. And so online learning has been very difficult for some of our kids. So we know it, right? So we have to weigh the balance between the risk of our children getting infected and then go home and spread it in their elderly family members versus the devastating effect on social and physical isolation at home. And so I believe that Orange County have done really well. And early on over the summer, we have worked very closely with all the school districts in Orange County, private and public, as well as Orange County Department of Education, to ensure that we support the teacher, support the parents to bring our kid home safely, back to school in person safely. And we have many schools has opened while we were in purple the last time. So we have opened a lot of TK to 6 school in Orange County. In fact, I think we ranked the county with the highest number of school reopened over the summertime. And then we went to the lockdown, and then we have to lock everybody down. And then we are in the process, as I mentioned earlier, Supervisor Wagner and everyone, I'm hoping that we will be able to reopen to school for our kids, because we will enter the red tier on March 17th. So that's the day when all school can reopen to bring their children back safely, because there are some guidance that they have to follow, things that school have to do, etc., to be able to bring our student back for in-person education. And I am so proud of school, because they've done a fantastic job in ensuring that they are preparing their environment safely for our kids to come back. So I look forward to that. Okay. I know you're very supportive of that as well. So.
Well, very supportive, and I appreciate that answer, and I want to make sure that it is heard out in the wider community that there are effects other than just the physical. There are substantial mental health impacts that the lockdowns and the response to COVID have caused, and there is no shame in seeking help. There are resources that are available through the county and certainly in other places. And so I want to thank HCA for making sure that aspect of coronavirus response remains front and center. If you need that help, it is available to you. If you think your children need that help, it's available. We will absolutely make it available, and you are not alone if that is something that you and your family are experiencing.
May I, Supervisor Wagner? I think that is a very, very important point, that from a parent's perspective and from our youth perspective, there is no shame in asking for help. We are all in this together, right? And so we have made access available 24/7. Either you need to talk to somebody or you want services, please do call us. Really, I say that to my own sibling and my nieces and nephew as well. No shame in asking for help. We know everybody's struggle. And thank God, I strongly believe that our children are very resilient. All they need is just a little bit of support and they will bounce back. But you got to start. You got to get the support to them. So thank you for that. That's very important.
Good. Yes, please access the help if you feel you need it or your loved ones need it. Let's get back to vaccines and talk for just a minute. One of the questions that's come in, and it is to my mind a fantastic question, is this. You talked about the tier system, and right now we have 65 plus are eligible. Healthcare providers are eligible. And the question is, why do we open up other tiers when we have not yet completed all of the healthcare providers, all of the 65 plus, all of that first tier?
Yeah, that's a question we have to ask Sacramento. As I mentioned, there's a group of folks that the governor put together, I think representing over 60 entities, in California, and that is the decision that they collectively have made. I just follow whatever the state allocated for us to do, right? And so I think I need to explain that. Starting this week, every week Orange County will get an allocation, as I mentioned earlier, and on the average, we get about 40,000 doses a week. And so the allocation currently sits at 10% on top of that is for preschool to 12 educator, okay? And then the remaining 90%, 70% continue to vaccinate our 65 and older. And then the remaining 30%, that's where we're supposed to vaccinate our educator in the higher education, colleges and university, food, agriculture and food worker. That includes supermarket, grocery store, and restaurant, including people who provide delivery, as well as emergency responder. But in Orange County, with the directions of our local community vaccine task force and the board of supervisor, we have started to include all of our first responder, particularly those who work in the high positivity rate area, into our phase 1A. So we have significantly done that. Our firefighter, our EMT, our emergency responder, etc. So we have vaccinated those folks. And so we're a bit ahead of other counties who have not done so. But as you pointed out, this bucket, this group, if you will, that part of the 30% allocation is huge. But the number of vaccines we get each week is really small. And that's why I'm asking people for really asking for your patience. I know everybody want to have the vaccine. That's a good headache for me to have, that many people want the vaccine. And you probably followed the news that we are hoping that by the end of this month, at least we'll get a lot more vaccine to come in. And yesterday, the president announced that by the end of May, the U.S. will have more vaccine, enough vaccine or more vaccine. I can't remember how he exactly put it. For all the adults in the U.S. who want a vaccine, they'll be available. So I look forward to that.
Well, so maybe that answers my next question, but your PowerPoint presentation is titled Operation Independence.
Yes.
We have a July 4th date to get everyone who wants to be vaccinated in Orange County vaccinated, so that we're closer to or have in fact achieved herd immunity.
Yes.
So the question we got was, is that July 4th date still a reasonable date?
Absolutely.
Awesome.
Absolutely.
That's what I want to hear.
But we need people to readily want the vaccine and no hesitant, right? That is the most important piece. We have to achieve herd immunity through vaccination. And people ask me, well, what is herd immunity? And that is at least 70% of our community have been vaccinated, so that we can openly, open our economy, open our society back to near normal, and so we can interact with each other safely. If the promise of vaccine availability is as such, I'm confident that Operation Independent will end before July 4th, and we will celebrate on July 4th.
I look forward to it.
I am too.
So that brings up the question. We're trying to get vaccines out to the people who want them.
Yep.
The question of Othina, which
Yes.
is the county's app for scheduling and helping people work through that process, comes up. You and I have had this conversation. We've had it privately. We've had it publicly.
Yep.
Othina was not without its challenges when it was rolled out.
Right.
Where is Othina currently in terms of our ability to use it, its ability to process our citizens as they try to get vaccines?
So yes, I acknowledge, and we have had this conversation.
We have.
You call me out publicly that we have people who in the beginning had trouble with Othina. Just like any developing app, new apps, you have to perfect it. And because we have such a short time to do it, there was glitches in the beginning, and I'll take full responsibility for that, right? But currently, Othina should be very smooth for people to enroll in it, as in English, as in Spanish, as in Vietnamese, as in Korean, and pretty soon it's going to be in a traditional and simplified Chinese. For people who don't have any ability to get on that, remember it's not just a phone app, but it's also a website. And then if you need help, you can call 714-834-2000, 714-834-2000, and people will help you get you enrolled. And we have also worked with community-based organizations. We have asked the city to support us, and we have asked Senior Center to help us in getting people enrolled in Othina. So, so far there has been very little complaints about the Othina itself. I think what the complaint that we've got and that we hear now is, well, I get on Othina, how come I don't have an appointment? Well, the reason being, we now over 700,000 people enroll in Othina, but I just share with you, every week we only have so few vaccines come in. And so you're sitting on the waiting room queue, right? And how we do that is we pay attention to the timestamp when you enroll into Othina. We pay attention to your age, and we pay attention to your eligibility list. And as soon as a vaccine is available, we open up the appointment, the calendar, and then we invite people, go down the list of that kind of different factor that we pay attention to, and then invite you to make an appointment. Mm-hmm. And so please be patient. The reason why you've not heard or you've not been contacted yet is that we just don't have enough vaccine to open it up for everyone.
One of the questions that we had from the public earlier is, why isn't there a place on the Othina app to enter other medical conditions? Only age and ethnicity.
Yeah, great question. And the reason being, people with health condition currently are not eligible yet. So you probably heard the rumor that on March 15, the governor and Department of Public Health would open the eligibility for individual with a certain set of health condition, right? And you can visit our website. We'll be posting what are those physical conditions. Mainly cancer, current cancer, if you are immunosuppressed because you are somebody who are on medication because you had an organ transplant, people with diabetes type 2, people who are obese, people who have sickle cell anemia, people who have Down syndrome, and I know a couple more, I think people with chronic kidney disease, and then some respiratory problem, lungs problem.
COPD.
Yeah, and so then you would qualify. At that time, then the question for you to register on Othina will ask you to attest, yes, I have this condition, yes, I have this condition, so then we can invite you to an appointment. Currently, it doesn't yet because we don't want to mess people up because they're not eligible yet.
Okay. And that also raises a question that just came in, so I can ask it now, in terms of other medications. If you're on another medication for, in the case of our questioner, asthma, blood pressure, pick an issue.
Yep.
How do those other medications interact with the vaccines that are available now? Something we need to worry about or not?
Nope, you don't need to worry about. The only thing that you will get asked when you get there is within the 14 days when you come to get your COVID vaccine, have you gotten another vaccine, right? Tetanus shot, shingle vaccine, and what have you. If you have, we ask you to wait because you want to get out of the 14 days window. And the only reason is within that 14-day, if you got another vaccine and then you get the COVID vaccine, then you have some side effects. We wouldn't know, well, which vaccine caused the side effect, right? And that's why we ask people that don't get two different type of vaccine within a 14 days window. That's all there is to it. But no medication interaction whatsoever.
Okay. And back to the Athena app in particular, a question from the community. What happens when you only have one email address for a household? How can the second person also get registered through Athena?
Yes, so I know that is an issue, and we are trying to figure out a solution for people to enroll in Athena where the entire family could get it together. Currently, that function is not open because remember, the entire family is not qualified yet because it's based on your age and it's also based on your profession. And that's why that function, it doesn't make sense. If you only have one address and then you call our number, 714-834-2000, we'll help and create an email address for you. But remember, you can get, the reason why we add the email address is because there are lots of people, believe it or not, have the same names and have the same birthday. So we have people who are John Doe on the same birthday. Well, we have to figure it out another way to differentiate who's who, and so we don't mix up with the different people. And that's why the email address is good because no one person have the same email address, and that's why that is a way for us to tease out people who have same name and same birthday. So if you don't have one, you call our number 714-834-2000. We will create an email address for you, just so we know you are different. You are John Doe A versus John Doe B, right? But if you have a phone, you can be notified via your phone as well. That's the reason why the email address came in.
Okay. All right. So it is no real surprise that some of the demographic that are currently eligible might only have one for a married couple, for example.
That's correct.
And so
when everybody's eligible, that's when we turn on that switch and said, hey, if you live in this family, here's one email address.
All right. How long does it take Athena to notify you of your vaccine appointment? What happens if that window is missed? Are you returned to the waiting room?
Yeah, that's a great question. So how long before you get an appointment? It's based on what I just mentioned earlier, Supervisor Wagner. If you get invited to an appointment, and if you don't make an appointment, I believe we send you a reminder. And then if we don't hear back from you, then you are put back in the queue, and we give that slot to somebody else to make an appointment. So let's say if we have 8,000 appointments for the next 3 days, we will invite 8,000 people to select the time that they want to come. And then if 5 of them didn't respond, then we invite the next 5 people to come in and make the appointment. And then that 5 people that didn't respond, we put them back in the queue. Now we know there are people who are on Athena, and then they also get the vaccine from the pharmacy. Just remind you, I mentioned earlier, you can take your chance with Rite Aid, Walgreens, and CVS by going onto their website, and then you can get an appointment and vaccinated from them. What we have done now is created an option where if you got your vaccine through Rite Aid, those pharmacy, and because they're not on Athena, we would ask you to come back to Athena and let us know that I got my vaccine somewhere else, right? So then we can keep that slot and give it to somebody else. Or even if you make an appointment already for 3 days later, but then tomorrow you got a vaccine from one of the pharmacy, we would ask you to come back and tell us you got the vaccine so we can give your slot to someone else. And then people would say, well, what is the benefit for me to go back and tell you I already got the vaccine, right? I get the vaccine. Well, what we are going to do is we are going to create a passport on Othina so that if you travel or if you need proof to show that you already get the vaccine, then that will be an incentive for you to come to tell us that you got vaccinated. It doesn't matter where you get it from, and you will be able to use the feature in Othina to show that you have been vaccinated. So,
Okay. And now, you touched on this briefly, but it's a great opportunity given the issue that you just raised. What are the differences between the first and the second shot? And if I am eligible for the second shot, say in a week or so, and I can't make it, am I at risk of wiping away all of the vaccine gains that I've originally made?
great question, Supervisor Wagner.
We owe it to the public out there that sent those in.
But I think you asked me that in private.
I have.
And so for Pfizer, the first Pfizer and Moderna, the first shot and the second shots are identical, right? And we now kind of refer the second shot to like as a booster, but basically you have to complete that series of 2 shots. Okay, so the time frame between the first and the second shot of the Pfizer vaccine is 3 weeks, 21 days. The time frame between the first and the second dose of Moderna's are 4 weeks, 28 days. Okay, definitely you shouldn't get your second shot sooner. The sooner you should get is about 2 days. That's it. You shouldn't get it any longer because in their clinical trial, you want the body to respond long enough, and then so when you give the second shot, and you will want the body to react to it and develop the antibody quickly, and that's why most of the time people have side effects on the second shot, right? If you have the side effects on the second shot, you know it works. Your body is responding to it. Okay. The drug maker and the FDA have and the CDC have recommended that if for some reason you couldn't make it for your second shot on time, 21 days or 28 days, you can wait up to 6 weeks.
6 weeks.
Yeah, from the first shot.
Okay.
Okay, so that's good. Now that's guideline, CDC guideline. There are situations where people can't come back within 6 weeks. You get sick of something else or what have you. You need to be in surgery or what have you. We still want you to come back and get your second shot. Okay? So the recommendation is exactly 3 weeks or 4 weeks, up to 6 weeks. But for some reason you missed your second dose, even beyond 6 weeks, we want you to come back and get your second shot. You should come back and get your second shot. Okay? That brings me to the next one. The Janssen, the J&J. The Johnson & Johnson is only 1 shot. So it's very convenient, okay? We will post information on all the vaccine on our website, so please visit our website, and so you know. At this point, honestly, whatever vaccine is available, we want to push it into people's arms because all 3 vaccines protect people, especially people with severe condition, from hospitalization or from death. So all 3 vaccines are very effective. Okay, people need to know that. And so I wouldn't have any concern. So let's say if you show up to a pharmacy, Walgreens, and they said, today we're offering this vaccine, should be no hesitancy. Get the vaccine. We want the vaccine into people's arms.
Okay, thank you. And do you, let me ask this, do the current vaccines address the increasing number of variants we're seeing out in the community?
Yes, luckily, with all this vaccine, the research area, researcher looking into whether or not this vaccine are protective. So far, it seemed like it's protective of all the variants. Particularly, you hear us talk about the West Coast variant. So there are some study reported that for the South African variant, it might not be as effective. But so far, for the other variant, it looks promising that people are still protected. If anything, the the efficacy probably drop a little bit, but not significantly.
Okay. And I understand there is the so-called California variant that is
Yes.
maybe as many, I think you've told me, as 50% of our cases have that.
In the Bay Area,
In the Bay Area,
Yes,
okay.
yes.
And these vaccines
Effective.
are
So far it's effective.
efficacious against that?
Yes.
Okay.
Yes.
Let me go to another question. When we get other tiers open and we're starting to allow folks with underlying health conditions and other reasons, what would be required for people to demonstrate they genuinely have those conditions, they genuinely are within that new tier?
Got it.
What's it going to take?
Yes, I think that's going to be very complicated, right?
Mm-hmm.
And it's going to be a hassle for people to go to their family doctor and demand a letter or want a letter to prove that they have these conditions. I think that is unfair for folks as well as unfair for the physician. We're going to go in Orange County, we're going to go with the honor system. Mm-hmm. So we're going to create those conditions on Athena website, and we are relying and trusting the community honesty for you to self-attest. So if you currently have cancer, then you will attest that, yes, I have cancer, and therefore I am eligible. So I am relying on the community honesty because we do know that there are people who need the vaccine who have those conditions. You and I talked about this before, right? So I think that these conditions truly, if I have my wand, folks with health condition should have been the next round to get the vaccine, so we get the protections for them. Mm-hmm. And so we are going to relying on people's self-attestation. Okay. We're not going to make it very difficult for folks because I don't think that's fair.
Good. All right. Well, we're coming up on our hard stop at 7. Let me ask just real quick 2 other points about the availability of the shots. You have in your slide the so-called super pods that we're operating right now. Any intention of adding extra sites?
Absolutely.
And what should folks do who maybe have a primary care physician and to see if they can access the vaccine that way instead of a super pod?
Yeah. So you probably heard me mention earlier, Blue Shield is going to do the allocation instead of the state. And so talk to your primary care physician. If your primary care physician sign on to be a partner with Blue Shield, then they can give the shot. Yes, when we have plenty of vaccine available, we have every intention to open up the superpod throughout Orange County geographically, so it's easy for people to have easy access. Mm-hmm. But moving forward, 2 or 3 years from now, the COVID vaccine, unless we establish a vaccine that gives us immunity long term, I imagine that every years, perhaps every year to 2 years, you need to go back to your physician. You need to get a booster shot, right? My goal here in Orange County is that every primary care physician, every pediatrician, and every pharmacy should be able to give you the booster shot when the time comes for your booster shot.
All right. Well, Dr. Chau, I think we're out of time. On behalf of the citizens of Orange County, I'm privileged to represent. Thank you, not just for this conversation, but for the work that you and the entire healthcare agency staff has been doing over the course of the last now almost a year. It is very much appreciated and is very much demonstrating that this county is doing the right things in terms of getting the vaccine out and our response. I will close with this. Thank you all for watching. The link that Dr. Chau mentioned for the OC links for some of the mental health issues that folks are facing, that phone number is 855-625-4657. I thank you for your interest. I urge you to go on to the healthcare agency's website, download the PowerPoint, get the mental health resources. I'm Orange County Supervisor Don Wagner. It genuinely is a pleasure to have the opportunity to serve you. And Dr. Chau, thank you to you and to your entire staff. Good night, everyone.
Thank you, Supervisor Wagner. Good night.